What would you say about this is one of my favorite topics about preventative care? Would you say that it's beneficial, and if so, then how often would you recommend us using that for our dogs?
Oh yeah, absolutely. I think that the way that even the physical exam in an Eastern physical exam is performed, you're getting different a different group of information that you can then utilize to assess the health of the dog. So typically what I do is I do a Western exam and then I do an Eastern exam. And the information I get from both of them will lead me to then say, okay, I think you should do this, and this. And I so that means you need to go to this type of doctor in order to do, to get x-rays because he's acting, the Eastern exam is showing that he's a little sensitive in these areas, which are typically associated with hip issues or arthritic issues. So yeah, I think you need to get x-rays or radiographs for the knee. Um, or if I am seeing that, I'm having to treat the ear a little bit more frequently, there might be some other stuff. Maybe there is a resistant ear infection that's just keep coming back a little too often. So I think you should go and get an ear culture and see whether or not, that is the case. And a lot of times it is. So, acupuncture can be one of those things that it can be an early detector, which is great for preventative medicine. And it also helps to uh, balance out the body. So if there is anything that might be a little off, whether it is, not sleeping as well, or the stool, the poop is like a little too soft, or maybe has changed color a little bit, or maybe even the breath. You think that the breath of your pet has changed. Maybe it's a sweeter smell, or it's a more of a funky smell, that kind of thing. Those are all things that acupuncture and Eastern medicine can then come in and help to identify earlier, and then help to guide what treatments and diagnostic tests and things like that could be recommended on the Western side.